The emergency room at St. Mary's Medical Center had seen its share of high-profile patients, but nothing quite like this. At 3:47 a.m. on a cold Tuesday morning in November, a convoy of black SUVs pulled up to the hospital's private entrance. Security guards in expensive suits emerged first, followed by personal assistants clutching phones and briefcases. Finally, they carried out the patient himself, Marcus Wellington, the tech billionaire whose net worth exceeded that of small countries. Marcus was conscious but clearly in distress. His normally commanding presence was reduced to that of a confused, frightened man. His wife, Catherine, walked beside the stretcher, her designer clothes wrinkled from what had obviously been a sleepless night. She kept repeating the same words to anyone who would listen: "He was fine yesterday. Completely fine. We had dinner, we talked about our vacation plans, and then, this morning I couldn't wake him up properly." Dr. Richard Harrison, the chief of emergency medicine, took charge immediately. He had treated celebrities, politicians, and other wealthy individuals before, but Marcus Wellington's case felt different from the moment he laid eyes on the patient. The billionaire's symptoms were bizarre and, seemingly unconnected. His skin had an unusual pallor, almost grayish in tone. His eyes, usually sharp and focused according to his wife, seemed distant and unfocused. Most concerning of all, his speech was slurred and he appeared to be having difficulty with basic motor functions. The medical team sprang into action with the efficiency that had made St. Mary's one of the most respected hospitals in the country. Blood was drawn, monitors were attached, and a battery of tests was ordered. The initial examination revealed several troubling findings. Marcus's blood pressure was dangerously low, his heart rate was irregular, and his reflexes were significantly diminished. When Dr. Harrison asked him basic questions about his name and the date, Marcus could answer, but his responses were delayed and sometimes confused. Catherine provided crucial background information to the medical team. Marcus was 58 years old and had always been in excellent health. He exercised regularly, followed a strict diet supervised by a personal nutritionist, and had regular checkups with the best doctors money could buy. His last physical examination just 3 months prior had shown perfect results across all measurements. There was no family history of serious illness, no known allergies, and he took no regular medications except for a daily multivitamin. The mystery deepened when the first round of test results came back. Marcus's basic blood chemistry was normal, his liver function was perfect, his kidney function was excellent, and his blood sugar levels were within the ideal range. The toxicology screen came back negative for alcohol, illegal drugs, and common poisons. His brain scan showed no signs of stroke, tumor, or injury. By all conventional medical measures, Marcus Wellington should have been the picture of health, yet he was clearly suffering from something serious. Dr. Harrison called in specialists. Dr. Amanda Foster, the hospital's top neurologist, examined Marcus thoroughly. She tested his reflexes again, checked his pupils' response to light, and conducted a series of cognitive assessments. Her findings were puzzling. While Marcus showed definite neurological symptoms, they didn't fit any recognizable pattern. It wasn't Parkinson's disease, multiple sclerosis, or any of the other common neurological conditions she had seen in her 20 years of practice. Meanwhile, Dr. James Chen, the chief cardiologist, was equally baffled by Marcus's heart irregularities. The electrocardiogram showed unusual patterns, but they didn't match any known cardiac conditions. Marcus's heart muscle appeared strong and healthy, with no signs of damage or disease. The irregular rhythm seemed to be coming from nowhere, with no identifiable cause. As the morning progressed, more specialists arrived. Dr. Sarah Martinez, an endocrinologist, examined Marcus for hormonal imbalances. Dr. Robert Kim, a gastroenterologist, investigated potential digestive issues. Each specialist ran their own tests and offered their own theories, but none could explain the full picture of Marcus's condition. Catherine grew increasingly frustrated as the hours passed without answers. She had hired the best private doctors money could buy, and now she was watching them all struggle to understand what was wrong with her husband. She made phone calls to medical contacts around the world, trying to arrange consultations with renowned specialists from Johns Hopkins, the Mayo Clinic, and other prestigious institutions. By noon, the hospital's administration had set up a special conference room where the growing team of doctors could meet and discuss Marcus's case. The room filled with some of the most brilliant medical minds in the city. Dr. Harrison led the discussion, going over each test result and symptom in detail. The neurologist presented her findings, followed by the cardiologist, the endocrinologist, and several other specialists who had been called in. The discussion grew heated as different doctors proposed various theories. Some suggested it might be a rare autoimmune condition that was attacking multiple body systems simultaneously. Others wondered if it could be an unusual infection that standard tests weren't detecting. A few proposed that it might be a genetic condition that had somehow remained dormant until now. Each theory was examined and tested, but none fit all the evidence. The autoimmune markers in Marcus's blood were normal. Additional tests for rare infections came back negative. Genetic testing would take weeks to complete, and Marcus's condition seemed to be worsening by the hour. As the afternoon wore on, Marcus's symptoms became more pronounced. His confusion increased, and he began having difficulty staying awake. His blood pressure continued to drop despite medication, and his heart rhythm became even more irregular. The medical team was clearly losing ground in their battle against an unknown enemy. Dr. Harrison authorized more aggressive testing. A spinal tap was performed to check for brain infections or unusual proteins in the cerebrospinal fluid. A more detailed brain scan was ordered to look for subtle abnormalities that might have been missed in the initial examination. Blood samples were sent to specialized laboratories for tests that wouldn't be available at most hospitals. Catherine refused to leave her husband's side. She sat in a chair next to his bed, holding his hand and talking to him even when he seemed unconscious. She told him about their children's latest achievements, about the charity gala they were supposed to attend next week, about anything she could think of that might bring him back to full awareness. The hospital's social workers tried to prepare her for the possibility that the medical team might not be able to find an answer quickly. They gently suggested that she might want to contact family members and close friends, just in case Marcus's condition deteriorated further. Catherine rejected this suggestion firmly. She had complete faith in the medical team and refused to consider the possibility that they might fail. As evening approached, more test results came in, but they only deepened the mystery. The spinal fluid was completely normal. The detailed brain scan revealed nothing new. The specialized blood tests showed no signs of rare diseases or unusual toxins. Marcus Wellington, one of the most successful and powerful men in the country, was seriously ill with something that modern medicine couldn't identify or explain. Dr. Harrison called his colleagues at other major medical centers, describing Marcus's symptoms and test results in detail. He spoke with specialists at Harvard Medical School, Stanford University Medical Center, and the National Institutes of Health. Each conversation followed the same pattern: initial interest, careful questions about the symptoms and tests, and then the same baffled response. No one had seen anything exactly like Marcus's condition. The medical team worked through the night, ordering additional tests and trying new approaches. They consulted medical textbooks, searched online databases of rare diseases, and even reached out to medical schools in other countries. The hospital's laboratory ran every test they could think of, looking for any clue that might explain Marcus's mysterious illness. Meanwhile, Marcus's condition continued to slowly deteriorate. His periods of consciousness became shorter and less coherent. His vital signs remained unstable despite the best efforts of the medical team. Whatever was affecting him seemed to be systemic, attacking multiple organs and body systems in a coordinated way that defied explanation. Catherine maintained her vigil, refusing offers of food or rest. She had built a successful business empire alongside her husband and wasn't about to give up now when he needed her most. She continued to believe that the medical team would find an answer, that her husband's brilliant mind would overcome whatever was attacking his body. As dawn approached on the second day, Dr. Harrison faced a difficult decision. He had exhausted the conventional approaches to diagnosing Marcus's condition. The hospital's resources were substantial, but they weren't infinite. He needed to decide whether to continue the current approach or try something more experimental. The clock was ticking, and Marcus Wellington's life hung in the balance. The medical team prepared for another long day of investigation and treatment. They had already consulted with 30 of the best doctors in the country, but none had been able to solve the mystery of Marcus Wellington's illness. Little did they know that the answer would come from an unexpected source, not from years of medical training or expensive equipment, but from the keen observation skills of someone they had barely noticed working quietly in the background. The second day began with an emergency meeting of the hospital's most senior physicians. Word of Marcus Wellington's mysterious condition had spread throughout the medical community, and doctors from other hospitals had begun calling to offer their expertise. Dr. Harrison found himself coordinating what had become the largest medical consultation in the hospital's history. Dr. Elena Rodriguez, the hospital's chief of infectious diseases, had arrived early that morning after hearing about the case. She brought with her a team of specialists who dealt with the most unusual and dangerous infections. Elena had worked with the Centers for Disease Control and had experience with biological weapons and exotic diseases that most doctors would never encounter in their entire careers. Elena's team immediately began testing for diseases that the previous doctors hadn't considered. They looked for rare tropical infections, bioengineered pathogens, and military-grade biological agents. Marcus's wealth and prominence made him a potential target for sophisticated attacks, and Elena wanted to rule out any possibility of intentional poisoning with an exotic substance. While Elena's team worked, Dr. Harrison received a call from Dr. Michael Thompson at the National Institutes of Health. Dr. Thompson had heard about the case through medical networks and wanted to offer his assistance. He specialized in undiagnosed diseases and had seen patients from around the world who suffered from conditions that stumped local medical teams. Dr. Thompson's first question surprised everyone: has anyone looked at the patient's environment in detail? Not just his medical history, but everything he's been exposed to in the past few weeks? This simple question opened up an entirely new line of investigation that the medical team had overlooked in their focus on traditional medical causes. Catherine was asked to provide detailed information about Marcus's recent activities, travel, and contacts. She revealed that 3 weeks earlier, they had returned from a business trip to Southeast Asia, where Marcus had been negotiating a major technology deal. They had stayed in luxury hotels and eaten at high-end restaurants, but they had also visited several industrial facilities and research laboratories. The environmental investigation revealed several interesting details. During their trip, Marcus had toured a semiconductor manufacturing plant in Singapore, visited a biotechnology research facility in Thailand, and attended a conference on artificial intelligence in Malaysia. Each location presented potential exposures to chemicals, biological agents, or other substances that might not be found in typical medical testing. Dr. Thompson suggested testing for industrial chemicals used in semiconductor manufacturing, many of which could cause neurological symptoms if exposure occurred in sufficient quantities. He also recommended checking for exposure to research chemicals from the biotechnology facility, some of which might not show up in standard toxicology screens. Meanwhile, more specialists continued to arrive. Dr. Lisa Park, a toxicologist from the University Medical School, brought equipment for testing heavy metals and rare poisons. Dr. Ahmed Hassan, an environmental medicine specialist, arrived with tools for detecting occupational exposures. The hospital's intensive care unit began to resemble a research laboratory more than a traditional patient care area. Marcus's condition remained stable but serious. The medical team had managed to stabilize his blood pressure and heart rhythm using medications, but they still had no idea what was causing his symptoms. He remained conscious for longer periods, but his confusion and weakness persisted. Most troubling of all, he seemed to be developing new symptoms as the days passed. Catherine noticed changes that the medical team had missed. Marcus's sense of smell seemed to be affected. He couldn't detect the scent of flowers she had brought from their garden at home. His hearing also seemed diminished, and he had difficulty following conversations even when he was fully alert. These sensory changes suggested that whatever was affecting him was continuing to progress through his nervous system. The new symptoms prompted another round of testing. An audiologist was called in to test Marcus's hearing, and the results showed significant hearing loss that hadn't been present in his medical records from just 3 months earlier. An examination by an ear, nose, and throat specialist revealed subtle changes in his nasal passages that might explain the loss of smell. Dr. Park's toxicology tests revealed the first potentially significant finding. Marcus's blood showed elevated levels of several rare earth metals that were commonly used in electronics manufacturing. The levels weren't high enough to be immediately life-threatening, but they were definitely above normal ranges. Dr. Park explained that chronic exposure to these metals could potentially cause some of Marcus's neurological symptoms. However, this discovery raised more questions than it answered. If Marcus had been exposed to these metals during his recent business trip, why had his symptoms taken weeks to develop? And why were his symptoms so severe if the metal levels in his blood were only moderately elevated? Dr. Park suspected that the metals might be just one part of a more complex picture. The biotechnology facility that Marcus had visited became the focus of intense investigation. Catherine contacted the company's management and learned that they conducted research on neurological diseases and were developing new treatments for conditions like Alzheimer's disease and Parkinson's disease. The facility used various experimental compounds and biological agents that might not be detected by standard medical tests. Dr. Hassan, the environmental medicine specialist, pointed out that many research chemicals could interact with each other in unexpected ways. If Marcus had been exposed to multiple substances during his trip, rare earth metals from the semiconductor plant, experimental compounds from the biotech facility, and other chemicals from the various locations he had visited, the combination might be causing effects that none of the substances would produce individually. This theory led to a new approach to treatment. Instead of trying to identify a single cause for Marcus's condition, the medical team began treating him for multiple potential exposures simultaneously. They started chelation therapy to remove heavy metals from his system, gave him medications to protect his nervous system from further damage, and began supportive treatments for each of his organ systems. Catherine felt a surge of hope as she watched the medical team implement this new treatment plan. For the first time since Marcus had fallen ill, the doctors seemed to have a coherent strategy rather than just responding to symptoms as they appeared. She allowed herself to believe that they might finally be on the right track. The hospital's public relations department was working overtime to manage media interest in the case. News outlets had gotten word that a prominent billionaire was seriously ill at St. Mary's, and reporters were constantly calling for information. The hospital issued brief statements confirming that Marcus was a patient but refused to provide any details about his condition or treatment. Security around Marcus's room was increased as well. The hospital was concerned about industrial espionage, given Marcus's position in the technology industry. They worried that competitors might try to gather information about his condition or treatment that could be used against his companies. Catherine had insisted on hiring private security guards to supplement the hospital's own security measures. Dr. Elena Rodriguez's infectious disease team continued their investigation into potential biological causes of Marcus's illness. They had ruled out most natural infections, but they were still testing for engineered pathogens and biological weapons. Elena explained to Catherine that while such attacks were extremely rare, Marcus's wealth and influence made him a potential target for sophisticated criminals or hostile foreign governments. The testing revealed traces of several unusual proteins in Marcus's blood that didn't match any known natural infections. However, the proteins were present in such small quantities that it was unclear whether they were causing his symptoms or were simply artifacts from the laboratory testing process. Elena decided to send samples to a specialized government laboratory that had experience with biological weapons detection. As the third day of Marcus's hospitalization began, the medical team felt cautiously optimistic about the new treatment approach. His vital signs had stabilized somewhat, and he seemed slightly more alert during his conscious periods. The chelation therapy appeared to be reducing the levels of metals in his blood, and the supportive treatments were helping his organs function more effectively. However, Dr. Harrison remained concerned about the overall trajectory of the case. While Marcus's condition had stopped deteriorating, he wasn't showing the kind of improvement that the medical team hoped to see. The treatment was addressing potential causes of his symptoms, but they still didn't have a definitive diagnosis. Without knowing exactly what was wrong, they couldn't be sure their treatment would be completely effective. The case had also attracted attention from medical researchers around the world. Dr. Harrison received calls from doctors in Europe, Asia, and Australia who wanted to learn about the case and offer their insights. Several medical journals had already contacted him about publishing a case study once Marcus recovered. The case was becoming a landmark in the field of diagnostic medicine. Catherine tried to maintain normal routines while staying close to her husband. She conducted business meetings by phone from the hospital, signed important documents that were brought to her by assistants, and made decisions about her husband's companies that couldn't wait for his recovery. The strain was beginning to show, but she refused to leave Marcus's side for more than a few minutes at a time. The hospital staff had grown accustomed to the constant activity around Marcus's room. Doctors came and went at all hours, specialists consulted in the hallways, and laboratory technicians rushed samples to testing facilities around the country. The case had become a professional obsession for many of the medical staff, who saw it as the challenge of their careers. As evening approached on the third day, Dr. Harrison prepared for another night of careful monitoring and incremental adjustments to Marcus's treatment. They had made progress in understanding potential causes of his condition, but they were still far from a cure. The clock continued to tick, and everyone involved knew that time was becoming increasingly critical for Marcus Wellington's recovery. Emma Chen had only been working at St. Mary's Medical Center for 6 months, but she had already earned a reputation among the nursing staff for her exceptional attention to detail. At 24 years old, she was the youngest nurse in the intensive care unit, having graduated at the top of her nursing school class. While the other nurses appreciated her dedication, some found her questions and observations almost excessive in their thoroughness. Emma had been assigned to work the night shift in the ICU, which meant she was responsible for monitoring Marcus Wellington during the quiet overnight hours when fewer doctors were around. She had watched with fascination as teams of specialists came and went throughout the previous days, each bringing their own theories and tests. As a new nurse, she felt privileged to witness such a complex medical case, even though she wasn't directly involved in the diagnostic process. During her first night caring for Marcus, Emma noticed something that had escaped the attention of the many doctors who had examined him. While checking his vital signs at 2 a.m., she observed that Marcus's pupils responded differently to light depending on the angle at which the light was shown into his eyes. When she used the standard penlight technique that all the doctors had used, his pupils reacted normally. However, when she accidentally dropped the penlight and picked it up from a lower angle, she noticed that his right pupil didn't constrict as much as his left pupil when the light came from below. Emma wasn't sure if this observation was significant, but her nursing school training had emphasized the importance of documenting any unusual findings, no matter how minor they might seem. She made a note in Marcus's chart about the asymmetric pupil response to light from different angles. She also made a mental note to observe this more carefully during her subsequent checks throughout the night. As the night progressed, Emma continued to make detailed observations of Marcus's condition. She noticed that his breathing pattern was slightly irregular, but only during certain phases of his sleep cycle. She observed that the skin color on his hands was slightly different from the color on his arms, with his hands appearing slightly more gray. Most intriguingly, she noticed that Marcus seemed to have moments of better awareness when he was positioned on his left side compared to when he was lying on his back or right side. Emma documented all of these observations in Marcus's nursing notes, even though she knew that most doctors typically focused more on the formal test results and specialist consultations than on nursing observations. She had learned in school that nurses often picked up on subtle changes in patients that doctors might miss because nurses spent more continuous time with patients and were trained to notice small details. The next morning, Dr. Harrison made his usual rounds and reviewed Marcus's chart. He was pleased to see that the night had passed without any major changes in the patient's condition, but he barely glanced at the nursing notes. His attention was focused on the latest laboratory results and the recommendations from the various specialists who had been consulting on the case. Emma worked the next 2 nights as well, and she continued to make detailed observations of Marcus's condition. She began to notice patterns in his symptoms that seemed to correlate with specific times of day and specific positions. She also observed that Marcus's responses to questions were clearer when he was positioned in certain ways, and that his motor coordination seemed better during some periods than others. On her third night caring for Marcus, Emma made what would prove to be the most important observation of the entire case. While helping Marcus change positions in bed, she noticed something unusual about the back of his neck. There was a very small mark, barely visible, that looked like it might be from an injection. The mark was partially hidden by Marcus's hair and was so small that it could easily be missed during routine examinations. Emma examined the mark more carefully with a magnifying glass from the medical supplies. It appeared to be a needle puncture mark that was several days old, consistent with the timeline of Marcus's illness. The mark was in an unusual location for any standard medical injection, and Emma couldn't think of any legitimate medical reason why Marcus would have received an injection in that particular spot. Emma immediately called Dr. Harrison, even though it was the middle of the night. She explained her observation and asked if she should document the finding more formally. Dr. Harrison was initially skeptical. Many doctors over the past few days had examined Marcus thoroughly, and it seemed unlikely that a new nurse would spot something that experienced physicians had missed. However, Dr. Harrison's medical training had taught him to take all observations seriously, regardless of their source. He came to the hospital immediately to examine the mark that Emma had found. When he saw it, he realized that she was right. There was definitely a needle puncture mark in an unusual location that hadn't been noticed during previous examinations. Dr. Harrison called Catherine immediately to ask whether Marcus had received any injections during his recent travels. Catherine was certain that he hadn't received any routine vaccinations or medical treatments during their trip to Southeast Asia. She also confirmed that Marcus hadn't seen any doctors or received any medical care in the weeks before he became ill. This new information completely changed the direction of the investigation. If Marcus had received an injection from an unknown source, it suggested that his condition might be the result of intentional poisoning rather than accidental exposure to environmental toxins. Dr. Harrison immediately contacted Dr. Elena Rodriguez and asked her to expand her testing to include compounds that might be administered by injection. Emma's observation also prompted a more detailed examination of Marcus's entire body for other injection sites or signs of physical trauma. The medical team found 2 additional needle puncture marks, both in locations that would be difficult to see without careful examination. The marks appeared to be from different injection episodes, suggesting that Marcus had been injected with substances multiple times without his knowledge. Catherine was horrified when she learned about the injection marks. The possibility that someone had deliberately poisoned her husband was even more frightening than the prospect of an unknown disease. She immediately contacted the FBI and requested a full investigation into the circumstances of Marcus's illness. She also hired private investigators to look into everyone who had access to Marcus during their recent trip. Dr. Elena Rodriguez's expanded testing revealed the presence of several synthetic compounds in Marcus's blood that were not found in nature. These compounds were sophisticated chemical agents that had been designed to cause neurological symptoms while being difficult to detect with standard medical tests. The compounds were present in very small quantities, which explained why they hadn't been found in the earlier toxicology screens. The discovery of synthetic poisoning agents was both a relief and a new source of concern for the medical team. On the positive side, they finally had a definitive cause for Marcus's symptoms, which meant they could develop a targeted treatment plan. On the negative side, these particular compounds were extremely sophisticated and had been designed specifically to cause maximum damage while avoiding detection. Dr. Elena consulted with experts at the CDC and with military medical specialists who had experience treating victims of chemical weapons attacks. She learned that the compounds found in Marcus's blood were similar to agents that had been developed by certain government programs but were not known to be available to civilian criminals. This suggested that Marcus's poisoning was the work of highly sophisticated attackers with access to advanced chemical weapons technology. The FBI investigation revealed that Marcus had been targeted during his business trip to Southeast Asia. Security camera footage from one of the hotels where he had stayed showed an individual approaching Marcus from behind while he was seated at a hotel bar. The footage wasn't clear enough to identify the attacker, but it showed someone making a quick movement near Marcus's neck area that was consistent with administering an injection. Emma felt a mixture of pride and concern as she realized the significance of her observation. Her careful attention to detail had potentially saved Marcus's life by identifying the true cause of his condition. At the same time, she was sobered by the realization that she had been caring for a victim of what appeared to be a sophisticated assassination attempt. The medical team immediately began treatment with experimental antidotes for the synthetic compounds found in Marcus's blood. The treatment was risky because these particular antidotes had not been extensively tested in humans, but Dr. Elena believed that the potential benefits outweighed the risks given Marcus's deteriorating condition. Catherine was kept informed of all developments in the case, but she was also advised by both the FBI and the hospital's security team to increase her own personal security. If someone had been willing to target Marcus with sophisticated chemical weapons, they might also pose a threat to other family members. The hospital implemented additional security measures around Marcus's room and began screening all visitors more carefully. They also assigned additional nursing staff to ensure that Marcus was never left unmonitored, both for his medical safety and for security reasons. Emma continued to care for Marcus during her night shifts, but now her role had expanded beyond routine nursing care. She was asked to document any unusual visitors or activities around Marcus's room, and to report immediately if she noticed anything suspicious. The quiet ICU had become the center of a complex criminal investigation. As the treatment with experimental antidotes began to take effect, Marcus showed the first signs of significant improvement since his admission to the hospital. His neurological symptoms began to stabilize, and his vital signs showed steady improvement. For the first time in days, Catherine felt genuine hope that her husband would make a full recovery. Dr. Harrison publicly praised Emma's observational skills and recommended her for a commendation from the hospital administration. He also made sure that her contribution to solving the case was documented in Marcus's medical record and in the case study that would eventually be published in medical journals. The case had become a landmark example of the importance of detailed nursing observations in complex medical cases. Emma's discovery had not only saved Marcus's life but had also exposed a sophisticated assassination plot that might have been used against other high-profile targets. Her careful attention to detail had proven that sometimes the most important medical discoveries come not from expensive technology or years of training, but from the sharp eyes and dedicated care of a committed healthcare professional. The experimental treatment began showing results within hours of its administration. Marcus's neurological symptoms, which had been progressively worsening for days, finally began to stabilize and then slowly improve. His confusion cleared gradually, his motor coordination returned, and his vital signs strengthened. For the first time since his admission, the medical team felt confident that they were winning the battle against his mysterious illness. Dr. Elena Rodriguez monitored the treatment carefully, adjusting the antidote dosages based on Marcus's response and the changing levels of synthetic compounds in his blood. The treatment was unlike anything she had administered before. The antidotes were experimental drugs that had been developed by military researchers for treating victims of chemical weapons attacks. Each dose had to be calculated precisely to neutralize the poison without causing additional harm to Marcus's already stressed organs. Catherine barely left Marcus's bedside during the critical first day of treatment. She watched anxiously as nurses administered the antidotes every few hours, carefully monitoring his reactions to each dose. The improvement was gradual but unmistakable. Marcus began speaking more clearly, his memory returned, and he started asking coherent questions about what had happened to him. The FBI investigation was proceeding rapidly now that they knew they were dealing with an assassination attempt rather than a medical mystery. Special Agent Sarah Mitchell, who specialized in international terrorism cases, had taken charge of the investigation. She interviewed Marcus extensively once he was able to communicate clearly, trying to piece together exactly when and where the poisoning had occurred. Marcus's memories of his business trip were initially foggy, but they became clearer as the antidotes continued to clear the synthetic compounds from his system. He remembered feeling slightly unwell during his last day in Singapore, but he had attributed it to jet lag and the stress of conducting difficult business negotiations. He had no memory of being injected, which suggested that the attacks had occurred when he was distracted or possibly when he had been given sedatives along with the poison. Agent Mitchell's investigation revealed that the assassination attempt was far more sophisticated than anyone had initially realized. The attackers had used multiple injection sites to administer different compounds over several days, creating a complex poisoning syndrome that was designed to mimic natural illness while being virtually impossible to diagnose quickly. The plot had been carefully planned to kill Marcus slowly while avoiding suspicion. The synthetic compounds found in Marcus's blood were traced to a laboratory in Eastern Europe that had connections to organized crime syndicates. the FBI discovered that Marcus had been targeted because of his company's recent advances in cybersecurity technology that threatened the operations of several criminal organizations. The assassination attempt was meant to eliminate him before his technology could be fully deployed against their activities. Emma continued to care for Marcus during his recovery, and she became something of a celebrity within the hospital. Her observation skills had not only saved a life but had also exposed an international criminal conspiracy. Medical students and nursing students began requesting to observe her work, hoping to learn her techniques for detailed patient assessment. Marcus's improvement continued steadily over the following days. The experimental antidotes successfully neutralized most of the poison in his system, and his body began repairing the damage that had been done to his nervous system and other organs. His hearing and sense of smell gradually returned to normal, and his cognitive function improved each day. Dr. Harrison used the case as a teaching opportunity for the hospital's medical residents and nursing students. He emphasized how the case demonstrated the importance of listening to observations from all members of the healthcare team, regardless of their experience level or position in the medical hierarchy. Emma's discovery had reminded everyone that careful observation and attention to detail were just as important as expensive tests and sophisticated equipment. The media attention surrounding the case continued to grow as news of the assassination attempt leaked to the press. Catherine worked with the hospital's public relations department to manage the coverage while protecting the family's privacy. She was determined to use the publicity to highlight the exceptional care that Marcus had received at St. Mary's and to recognize Emma's crucial contribution to saving his life. Marcus's companies had continued to operate under the leadership of his executive team during his hospitalization, but important strategic decisions had been postponed pending his recovery. As his condition improved, he began participating in critical business meetings by video conference from his hospital room. His first priority was implementing additional security measures for all company executives and key employees. The hospital's administration decided to implement new protocols for examining patients based on lessons learned from Marcus's case. All patients with unexplained neurological symptoms would now receive more detailed physical examinations specifically looking for injection marks or other signs of intentional poisoning. The administration also increased training for nursing staff on recognizing signs of criminal activity or intentional harm. Emma was promoted to a senior nursing position and was given additional responsibilities for training new staff members. She was also asked to develop protocols for detailed patient observation and documentation that could be used throughout the hospital system. Her success had proven that sometimes the most important medical discoveries come from fundamental nursing skills rather than advanced technology. The FBI's investigation led to the arrest of several individuals involved in the assassination plot. International cooperation with law enforcement agencies in Europe and Asia resulted in the disruption of a sophisticated criminal organization that had been targeting business leaders and government officials around the world. Marcus's case had uncovered a much larger conspiracy than anyone had initially suspected. Dr. Elena Rodriguez published a detailed case study about Marcus's poisoning and treatment in several medical journals. The case became a landmark example of how to recognize and treat victims of sophisticated chemical weapons attacks. Medical schools around the world began including the case in their curriculum as an example of the importance of considering intentional poisoning in cases with unexplained symptoms. Marcus made a complete recovery after 2 weeks of treatment and observation. His final medical tests showed no lasting effects from the poisoning, and his neurological function returned to normal. The experimental antidotes had been completely successful in neutralizing the synthetic compounds and preventing permanent damage to his organs. On the day of his discharge from the hospital, Marcus held a press conference to thank the medical team that had saved his life. He made a special point of recognizing Emma's contribution, describing her as the person who had solved the mystery that had stumped 30 experienced doctors. He announced that he was establishing a scholarship fund for nursing students and making a substantial donation to St. Mary's Medical Center. Emma attended the press conference, still somewhat overwhelmed by the attention her observation had received. She used the opportunity to emphasize that her discovery was the result of fundamental nursing skills that any good nurse should possess. She encouraged other nurses to trust their observations and to speak up when they noticed anything unusual about their patients. Catherine publicly thanked the entire medical team and nursing staff who had cared for her husband. She was particularly grateful to Emma, whom she credited with saving Marcus's life through her careful attention to detail. The family announced that they would be funding a new research program at the hospital focused on detecting and treating victims of intentional poisoning. The case had a lasting impact on medical practice at St. Mary's and other hospitals that studied the case. Emergency departments began implementing new protocols for examining patients with unexplained symptoms, specifically looking for signs of intentional harm. The case also led to increased cooperation between hospitals and law enforcement agencies in cases involving potential criminal activity. Marcus returned to work gradually, implementing new security measures for himself and his family while continuing to lead his technology companies. The assassination attempt had only strengthened his resolve to develop cybersecurity technologies that could protect people from criminal organizations and hostile governments. His experience had given him a personal understanding of the threats that many people faced in an increasingly dangerous world. Emma continued her nursing career at St. Mary's, where she became known for her exceptional observation skills and attention to detail. She eventually became a nursing supervisor and continued to train new staff members in the importance of careful patient assessment. Her discovery had reminded the entire medical community that sometimes the most important breakthroughs come not from years of training or expensive equipment, but from the dedicated care and sharp observation skills of committed healthcare professionals. The case of Marcus Wellington's mysterious illness became a classic example of how teamwork, persistence, and attention to detail could solve even the most complex medical mysteries. It demonstrated that every member of the healthcare team had an important role to play in patient care, and that sometimes the newest and least experienced team members could make the most crucial discoveries. Most importantly, it proved that careful observation and genuine concern for patients remained at the heart of excellent medical care, no matter how advanced technology became.